All right. So please, everybody, this is known as the mention practice training that we used to do in the past, but due to its difficulty, I stopped it for some time. Now we are restarting this mention practice. We should do at least, every student should do at least 50 mention practice training. Some of the videos are already available on YouTube channel. Otherwise, it is really good to do this one now. All of you listen to me completely. So if you are a bit new here, all you have to do is, there are 10 statements here, 10 statements, which are kind of taken from this paragraph. Read this paragraph very carefully and then say these are mentioned or not mentioned. Mentioned or not mentioned. That's all. But this is not very easy. This task is not very easy. You will think that this is mentioned, but it may be not mentioned. You will think that this is not mentioned, but this may be mentioned. So all the best. And if you can get 8 out of 10 in these kind of tests, you are excellent in reading and even listening. All the best. You have exactly 10 minutes from now. If you have a question, you can ask me right now. Anybody having a question, you can ask me anytime. Shiva, if you have a question, you can ask me now.
Okay, sir.
All right, please start doing this. You have 10 minutes. The time almost started. Please read the paragraph above. Go to 1 to 10 statements. Say if they are mentioned or not mentioned. And if you can score 8 out of 10, your reading and listening scores are supposed to be very high. Try to get 8 out of 10 today. Your time is, you have got more than 6 minutes now. Those who have completed, please raise your hands. So far, only Jaswin and Alvin have been able to complete. Others, please work your brain out. Please work your brain and complete them and raise your hand. Please hurry and complete fast. We are starting the discussion in 5 minutes. We are starting the discussion in 5 minutes. Please complete. Mahalashmi, Abhishola, Anjana, you have not completed. Matilda, good. Parag, you have done. Please do a bit fast. Godfreda, please complete fast. Rose, Shweta, we are taking too much time. Come on, decide fast and raise your hands. 18 out of 34. Not enough. Not enough. You have 2 minutes, 30 seconds. Twenty-one out of 35. Your time is not yet over. You have 1 minute, 30 seconds. Please complete fast. If you did it in a hurry, you can check your answer and you can correct your answer if you want. Twenty-two out of 35 people have done. You have 60 seconds more. Please complete. Mahalashmi, you have not done it. Himani, you have not done. Anjana, you have not done. Please make any suggestion. No problem. It's okay. Your answer may be wrong, right? It's okay. but you have to make a suggestion. You have to make a choice. A choice is very important. Okay, no problem. Next time we will be doing the choice. This time the time is over. Only 15 seconds remaining. All right, the time is over. Everybody, now please stop doing this. You have to listen to me completely throughout this class. Look at this. Displaced nasogastric feeding tubes means uh, irreversible implications. Okay, first of all, let me tell you, implications, the meaning of implication simply means imply. What is meaning imply? Imply. Imply means mean. It has no connection with the complications. But many people, if you look at Google dictionary, for example, Malayalam Google dictionary or Hindi Google dictionary, you will find a word which means complication or after effect. So implications do not mean that. Please understand that. So if anybody in this class is using a local dictionary, like you are a Malayali and you are using Malayalam dictionary, please be careful. You are doing a very blunderous mistake because there are, but actually the meaning is not given by Google. Google is just a search engine. So I was just looking at the Malayalam dictionary just during this class. I saw the meaning is very much different from what is real. So please don't look at the Malayalam, Hindi, Marathi, Tamil, or those dictionaries. They are going to misguide you. Be careful about that. All right. So we are moving to the discussion now. Displaced nasogastric feeding tubes mean irreversible implications. Do they really mean once? Suppose you, Leela is a nurse and she has got experience and special training and she is doing the nasogastric insertion. So she just displaced it. She just displaced it, and after a few seconds, she realized her mistake and she changed the position. And first, it was displaced. Just because of that displacement, do you think that this is going to have a irreversible implication? Nowhere it is mentioned because it should be displacement of nasogastric feeding tubes can mean serious implications if undetected. In the case of Leela detected it after a few seconds. So that is the reason why the first one is irreversible and those things are not at all here. So the first one is not mentioned. So those who wrote not mentioned are getting 1 score. Others lost it. Others simply lost it because of their carelessness. Every day, OET students are just spending or wasting their time on sample papers. And at the end of the day, they start where they stopped. Sorry, they stop where they started. So please understand, learning the word meaning is most important ones, and doing this kind of training is more important for. See, actually, the sample papers are meant only for the exam batch people. Are you in the exam batch? No problem. You can go ahead with doing sample papers. But if you are a beginner, if you have not booked your examination, you are not in the exam batch. So you are supposed to be doing this kind of task every day. I'm going to the second one. And if anybody has any kind of confusion, any kind of disagreement with me, you can call me. You can ask me even during this class. Okay. If the displacement is detected, NG tubes do not cause any harm. See, in the same case, if the displacement is detected by Leela is a nurse, and she inserted this one. She is an experienced person. She inserted an NG tube and she detected it after an hour. After an hour, she detected this one. So NG tubes do not cause any harm. Can you say that? Here, of course, harm is indirectly mentioned everywhere here. So not from the word implications, but also from other areas you can see there are. See, for example, insertion to prevent potential fatal pulmonary complications. So everything is indirectly mentioned here. So my point is, if the displacement is detected by Leela, the nurse, after 2 hours of inserting the NG tube, Can we say that it will not cause any harm? No, we can never say that. Okay, do not cause any harm is a problem here. We cannot say that. See, I'm taking two examples. One, nurse Leela she found that there was something wrong with the placement of the or insertion of the NG tube after a few seconds. So this will not cause any irreversible implication or any problems here. Second one, if Leela, the nurse, detects it after 2 hours after the insertion, we cannot say that this will not cause any harm. It will cause harm. At least we cannot say it does not or it do not or it does not cause any harm. So I hope this part is so clear to everybody. When the NG tube is positioned incorrectly, patients experience regurgitation and respiratory aspiration. Yeah, these complications are mentioned here. These two complications are there. Regurgitation and respiratory aspirations are there. But the problem is, when the NG tube is positioned incorrectly, patients experience. Again, you can take the example of Leela. Look at this one. Where do you find that one? Where is that? Yeah. If you look at this one, incorrectly positioned tubes leave patients vulnerable to the risk of regurgitation and respiratory. They are vulnerable to. What is the meaning of vulnerable? Vulnerability is there. There is a vulnerability. There is a risk factor. So if you look at the third one, when the NG tube is positioned incorrectly, patients experience. So is it necessary that patients will always experience? Remember, patients experience. Is it necessary? Patients may experience is fine. Patients can experience is fine. Patients might experience is also fine. But when you do not have these words, which are these words? The M words. Which are the M words? M words are may, might, can, could, will, would, shall, should, and must. These are the M words. If M words come, the number will be up or down. But when there is no M word, patients experience, for example, Shiba experiences pain, which means Shiba is still experiencing pain. Every morning, Shiba experiences headache. Every morning, Shiba experiences headache, which means she every day she experiences it. But if you insert this one, this M word, if you insert this M word, today Shiba may experience, that is only 50%, that is 5 out of 10 possibility. Okay, here I'm using another one, must experience, that is 9 out of this. Today, Shiba may or can experience, that is again 6 or 7 or more than that. Or might experience, this is just like 4 out of 10 or 40%. But when you remove all these words, this is 10 out of 10 or 100%. Patient's experience means they should 100% they should experience. So here, can you say that patients experience regurgitation? Because it says that they are vulnerable to the risk, doesn't mean that they will definitely experience. So we are removing this one also. Patient's experience is a problem. This is also not mentioned according to the paragraph. Some of you are feeling very bad because they lost all the three of them, right? Some of you, please understand this. This 1 hour of training is more important than 1 day of completing a lot of sample papers. I'm not saying that you shouldn't, you have to do the sample papers, but without the strategy, what is the point of doing all this practice? That's very important. Okay, incorrect placement or insertion of NG tubes can lead to death. Can lead to death. Yeah, that seems to be a correct statement. Death means there is potentially fatal pulmonary complications. Yeah, fatal. Fatal means something that leads to death. Fatality. Death. Basically, fatality is death. Potentially, that means possibly. Okay, that is, we have a word, incorrect placement or insertion of NG tubes can Can lead to. I didn't say leads to. I said can lead to. That is only a possibility. So can is equal to potentiality. See, potentially. This one can. Okay, that is completely correct. Same. So we can, some way we can say that that sentence seems to be somewhat mentioned one. Let's see. Can lead to death. Can is potentially, death is fatal, and incorrect placement or insertion of NG tubes. Where is that? You can find it is crucial to differentiate between, sorry, what is that? There is, okay. Yeah, placement on initial insertion to prevent potentially fatal pulmonary complications. Potentially fatal, that means it can happen. So if you do not differentiate between gastric and respiratory placement on initial insertion, which will go and which can lead to potentially fatal pulmonary complications. So fourth one, incorrect placement or insertion of NG tubes can lead to death. So since we use the word can, you can directly go and find that this can is really there. It is a mentioned statement. Some of you don't agree with me. Please talk to me. If you don't agree with me, you can tell me, or you can ask me questions right now. Because I am not just a somebody who is giving the lecture here. I am ready to accept your own feedback. Please come forward and you can ask me. If you don't agree with any of them, you can speak to me right now. Why you don't agree with one of them? 1, 2, 3, 4. You don't agree with. This is a very serious request I am making to everybody. If you don't agree with any of my conclusions, you have to say that I am wrong. Now, going to the fifth one, any registered doctor or nurse can insert an NG tube. Anjana is a registered nurse. Do you think Anjana is able to do that? No, she cannot. Any registered doctor or nurse cannot do that, because not only registration, doctor or nurse who has undergone theoretical and practical training in NG tube insertion and is deemed competent, that means able, and or is supervised by someone competent. So first thing is that you should be a registered doctor. Second one is that you should have undergone theoretical and not or. Remember, or and are really dangerous words. And is plus, or is this one. Okay, so that means only one is required. But in this case, both of them are required. And is deemed competent. These three things are important. Registered doctor or nurse, you should be registered first. Okay, then the second one, you should have undergone this. And third one, you should be deemed competent. You should be certified. You should be deemed competent means you should be certified. Okay, supervised by someone. Okay, competent or supervised by someone. Okay, the last one, supervision is an option. Either you should be deemed competent or you should be supervised by someone who is competent. But at the same time, these three are important. Registered is one. You should have undergone theoretical and practical training. Third one, deemed competent. These are the three eligibility criteria. And then there is, if you are not deemed competent, okay, no problem. You can go with the supervision of somebody who is, okay. So there are 4 things. Out of them, 3 are mandatory. This one is mandatory. Undergone is mandatory. Deemed appropriate, sorry, deemed competent is mandatory. If the third is not possible, then this should be there. So let's come to the fifth one. Any registered doctor or nurse can insert an NG tube is incorrect, because Aishwarya is a registered nurse, but she has not undergone the theoretical practical training, and she is not deemed competent. Okay, so for that reason, fifth one is not mentioned statement. Okay, I want everybody to stay in this class till the end. Usually what happens, some people will leave the class because they feel that their scores are going very bad. Sometimes it happens. Please face the reality. Please face the reality. Don't run away from here and just go to your sample papers and waste your time. All registered doctors and registered nurses have undergone theoretical and practical training for NG tube insertion. I think everybody is going to get a score for that. All registered doctors and registered nurses have undergone theoretical and practical training. No, that is nowhere mentioned here. All of them. That is the main problem, is all of them. Yeah. For example, again, I'm taking the example of Molly or Rose Maria. Rose Maria is a registered doctor. Just suppose she's a registered doctor in the UK right now, but she has never undergone the theoretical and the practical training. So can we say that all registered? No, not necessary. It is not necessary. So we are skipping this. Seventh one, supervision is always mandatory in inserting NG tubes. Supervision is always mandatory. Supervision. Here we have got supervision here, supervised by someone. This is not mandatory. Whenever you find the word or is not an indication of mandate. It doesn't mandate anything. It is not mandatory. Okay, so it is not mandatory, so we should go with the other option. Supervision is always mandatory. It is not mandatory, not even always. For these two reasons, this is not, because if Rose is a registered doctor or a nurse who has undergone theoretical and practical training and is deemed competent, then she doesn't need any mandatory supervision by a competent someone. Okay, clear to you. Supervision is always mandatory is a problem here. So we don't want this not mentioned statement. So far, only fourth one is the mentioned one. I believe that most of you have so far scored a very good mark so far. All right. All assistant practitioners are unregistered. All assistant practitioners are unregistered. Do you think a person, especially in UK or other countries, can an assistant doctor be an unregistered doctor? Have you heard about that? Anybody from UK? Have you seen anybody in the UK from the UK right now in this class? This is my personal confusion. Do you think you are a doctor and you are an assistant doctor? Can you work as an assistant practitioner or a doctor in a hospital without being registered? Can you? Anybody knows that? No. So yes, even if it is like that, you cannot say just because of the reason, all is also here. For these two reasons, we cannot go with that. All assistant practitioners are unregistered. We cannot say that. It is not mentioned. The question is it true or false is not the question here. We are not talking about true, false. It is only talking about is it mentioned or not mentioned. So next time, to get your full score, you have to differentiate between personal opinions, writer's opinions, researchers' opinions. There are three kinds of opinions. Most of you are going with your personal opinions in the examination hall. In the examination hall, your IQ level is going to be very, very low, especially if your exam is, you're writing the first exam. So by that time, you will forget all the rules and regulations taught by your teachers. So you will go with your personal opinions because of the hurry-burry of the examination hall. So that is the reason many people do not pass in the first examination, but I wish everybody in this class passes. Okay, we are moving back to the ninth one. Let's do this. Every medical staff is not authorized to insert NG tubes. Every medical staff is not authorized to insert NG tubes. Yes, very clearly it says that must never insert. Did you see this? Must never insert. It's very clearly here. Okay, so the ninth one, every medical staff is not authorized to insert NG tubes is very clear, it is mentioned. And last one, only supervisors can be involved in the initial confirmation of safe NG tube positioning, and that is only supervisors is the problem. Others can also do that. Okay, and supervisors are not supposed to be doing this one. Supervision is done by somebody else, and nowhere it says that supervisors can do this NG tube insertion. Because supervisor's role is only to supervise somebody who is registered and having completed theoretical and practical training. So we have to say that this is also incorrect one. Okay, just for curiosity, can I know how many of you got 8 or 9 or 10? Just for curiosity. Only 8 out of 41 participants. All right. So what do you feel? Others? Okay, leave it. How many of you got 6 and above? 6 and above. 6 and above. Hmm. 14. Only 14 out of 42. Some of you came late, so 15 out of 40. Let's count it like that. So are you going to be sad today? Are you going to be sad? Oh, I don't want OET. So I tell you, for writing training, I can train anybody in just 1 week. I can make your score 350. It's my personal belief. But for reading, some of you will take up to 5 months. 5 months. This is very important. Please understand that. So without that, you won't be able to clear OET. So OET's biggest problem is reading these days, and you should be highly competent in reading. All right, no problem. We are moving back. And today, if you totally agreed with me with all these answers and my conclusions, you have really benefited from this class. But if you are still doubtful about my answers, you are simply wasting your time.
Sir, excuse me. Ninth one, can you explain again?
Every medical
Actually,
staff.
there's a doubt with the ninth one, sir.
One second, please. Yeah, Tanuja and Leela.
Mention
Leela,
as
let me just answer
evidence.
your question first. Leela, let me answer your question first. Tanuja, you can ask me secondly. Okay. Every medical staff is not authorized to insert NG tubes. Okay, I think that was not very difficult. Okay, it's good to ask me questions because sometimes I can also commit mistakes. Here, every medical staff is not authorized. What is the meaning of every? Every does not mean all. Every boy has to. You know that. When you do speaking, I have heard some people speaking that this way. Every nurse are. Do we say every nurse are? Every nurses are. Some people say this way. Every nurses are experienced in this hospital. Every nurses are. We cannot say that every nurses are. See, even Google is also supporting me. Every nurse then is. So every and all are different one. First thing. Now, this statement says assistant practitioners and other unregistered staff must never insert NG tubes or be involved in the initial confirmation of safe NG tube positioning. Assistant practitioners, probably they have not got a special training for that. And other unregistered staff like nurses must never insert. So the ninth one, every medical staff is not authorized to insert NG tubes is very clearly mentioned here. Is that clear to you, Leela?
Yes, sir. Yes, sir. Thank you.
See, because your questions may be very silly. You may be thinking, okay, my question is very silly. If I ask this question, others are going to laugh. Others are going to laugh only when you fail several times. Nobody is going to, cry with you at that time. So yes, and somebody else also was asking another question. Who was that? Vinny, was that you who asked this question? Somebody was asking a question. Tanuja, was it you? All right.
Now it's okay, sir.
Okay, fine. So whatever the questions you have, please ask me right now. I will be really happy to sit the whole day with you if you are all ready to sit with me for a long time, because reading is the biggest problem. Writing is okay. Speaking is also kind of okay. And listening is also, we can do that. Listening, when we talk about listening, we have to go to listening for a break. So don't leave this class. You're just going to listening. This is going to be our listening today. Please listen to the audio. And there are only 4 questions for you. This is part A type of question. You can listen to that.
I'd like to hear a more personal account from urologist. Your GP has referred.
Listen to this and please mute your mic.
So, Mr. Peterson, I'm Dr. Muller. your gastroenterologist. Your GP has referred you to me with a detailed case history of yours. That was a week ago. Since you delayed your visit here, I would like to hear a more personal account from you. So how would you describe your condition now?
I'm not doing so well, actually.
I know. You have been experiencing some worsening back pain, difficulty breathing, and my gastritis seems to be acting up again, right?
Yay.
When did you first notice the back pain? And can you describe the type of pain you're experiencing?
The back pain started about a week ago, and it's been getting progressively worse. It's a dull ache that seems to radiate from my lower back, and it's particularly bothersome when I'm trying to move around or bend over.
Have you experienced any recent injuries or accidents that might have triggered this pain?
No, nothing like that. I've been careful, and I haven't done anything out of the ordinary that could have caused an injury.
Okay, let's talk about your breathing difficulties. When did those symptoms start? And have you noticed any patterns or triggers?
The breathing difficulties started around the same time as the back pain. It feels like I can't take a deep breath, and sometimes I get short of breath, even when I'm just sitting still. I haven't noticed any specific triggers.
Please write the answers. There are 4 answers for you. Please write the answers from your memory. You'll be able to listen to this audio once again. You can listen to the audio once again.
To be acting up again, right? I know. You have been delayed your visit here. I would like to hear when did those symptoms start?
Sorry.
The back pain.
You have been experiencing a history of yours. So, Mr. Peterson, I'm Dr. Muller, your gastroenterologist. Your GP has referred you to me with a detailed case history of yours. That was a week ago. Since you delayed your visit here, I would like to hear a more personal account from you. So how would you describe your condition now?
I'm not doing so well, actually.
I know. You have been experiencing some worsening back pain, difficulty breathing, and my gastritis seems to be acting up again, right?
Yay.
When did you first notice the back pain? And can you describe the type of pain you're experiencing?
The back pain started about a week ago, and it's been getting progressively worse. It's a dull ache that seems to radiate from my lower back, and it's particularly bothersome when I'm trying to move around or bend over.
Have you experienced any recent injuries or accidents that might have triggered this pain?
No, nothing like that. I've been careful, and I haven't done anything out of the ordinary that could have caused an injury.
Okay, let's talk about your breathing difficulties. When did those symptoms start? And have you noticed any patterns or triggers?
The breathing difficulties started around the same time as the back pain. It feels like I can't take a deep breath, and sometimes I get short of breath, even when I'm just sitting still. I haven't noticed any specific triggers.
You can complete the answers now. Please write the answers. You have to write the exact word that you heard in the audio. Do not change the words. All right, there are some questions here. Anybody wants to answer all the questions? Anybody? Any single person wants to answer all of them, please? Please
Yes,
come
sir.
forward. Yeah, please. What are they?
The first one, gastroenterologist.
The patient was first referred. No.
GP.
GP.
The patient was first referred. We don't
GP.
have.
A week ago, sir.
If it is a GP something, then there should be by somebody must be there. Since there is no by somebody, and also such answers will not come in the questions. You know the reason? By whom is never important here, but when it was. Okay, so the name of the patient also is less asked these days. So the first answer is supposed to be, if you listen to this, you can see a week ago will be the right answer. A week ago. Was it the right one a week ago? But if you wrote A capital, you lost your score. But if you have written a week ago this way, you got the full score here. A week ago will be the full correct answer. First one. Going to the second one, can somebody tell me what is the second one? Back pain developed.
About a week ago.
Okay, developed. So the first one was a week ago. That is, clarity is there. The second one is about is there. About, even here also a small letter, about a week ago. That will be the second one. Third one.
Bend over.
Yeah, bent over. What was your spelling, please? Can you tell me the spelling of this? Did you write B-E-N-T or B-E-N-D?
B-E-N-D.
This one?
Yes.
Yeah. If you wrote B capital, or if you wrote T in the place of D, in all those cases you are losing the score. Okay. In this case, second one, if you missed this about, you can lose your score for that. See, OET listening is very tricky, and you are supposed to be like an American or a Britisher or an Australian, because in India or in many other Asian countries, people are becoming heroes by doing big things, but in those countries, they are doing heroes by doing the smallest things. So we have to show our expertise in small things and big things together. I mean, alike. So please be careful about your spelling, handwriting, every detail. Every detail is very important here. I hope you understand. There is a fourth one. What can be the fourth one? Sometimes experience a short of breath even when sitting.
Still.
Just one single word, still. Okay, and if you make it S capital, this is the right answer, right? Still, right? Still. Yeah.
Yes, sir.
This is the way you have to. This is the reason why many people say that they are not getting score. See, please look at your spelling. Spelling is very important. For some people, week is still like this one. This week, they are writing this week. Okay. For some people, they are writing still this way. And they are writing until this way. Wrong. Until is having only one L. Okay. So many things are to be considered when you are preparing for OET. I mean, basically, our Indian mentality is good. In many ways, Indian mentality is good. But in some ways, because everywhere, every country has got their own limitations. Americans also commit mistakes. Australians also commit mistakes. But in India, especially talking about India, Sri Lanka, and countries here, especially in these areas, the quality-wise, we have to grow a lot. There's no point of saying that our country is the most beautiful country in the world. Okay, we are really, every country has got something new, but for passing OET, you have to be a global citizen rather than just an Indian citizen alone, because the whole world is ours. Okay, so you should be changing your mentality as well. Okay, so with this, the listening part is being terminated here, and we have to complete the next part of reading. The continuation of yesterday's and the day before yesterday's class is here. Now, this is a new paragraph for us today. Here are some questions. There are 6 questions are here. I hope we can complete all these questions as fast as possible. Please complete fast. Here is your first question. Please do fast. This is a continuation of yesterday's one. If anybody is tired, please take a coffee, something, and please don't leave the class because it is most important. Please complete the first one. Please do 9.1 and 9.2. Those who complete, please raise your hands. So let's conclude this session. We have just 5 minutes for the session to be completed. Let me just explain this. Bob McCarthy and colleagues found that cats could be kept awake by playing with them. By playing with them, cats could be kept awake by playing with them. They found that. Was that the finding? Cats could be kept awake longer than other animals. There is no comparison here. So comparison is eliminated. We can easily eliminate comparisons. No other animal is mentioned here. Adenosine levels increase in the basal forebrain when cats are not asleep. Adenosine levels increase in the basal forebrain when cats are not asleep. Is it mentioned? Is that something that they found, the team found? Adenosine levels increase in the basal forebrain when cats are not asleep. Is it cats are not asleep or cats are asleep? We have to find that. The last one, sleep deprivation in cats raises the levels of adenosine. Sleep deprivation in cats raises the levels of adenosine. What is your answer? How many of you selected A as the right answer? Will you please raise your hands? Those who got A as the right answer, would you please raise your hands? A. Just to see your way of thinking. Just to see your way of thinking. There are 6 participants who thought A as the right answer. No, 6, 9, 5. Only 5 people think that it is right. Second one, cats could be kept awake longer than other animals. I'm sure nobody thought that way. Going to the third one, adenosine levels increase in the basal forebrain when cats are not asleep. Is it? How many of you support this one? Please raise your hands. Those who support C, please raise your hands. There are 8, 9, 10. Will the number go high? 13 out of 41. 16 is going to be a majority now. This is going to be a majority. This is going to be a majority. 16. Okay, please put your hands down. And how many of you support the last one? Sleep deprivation in cats raises the levels of adenosine. How many of you support D? Very few supporters for D. Please put your hands down if you don't support this. There are 9 participants who support this. No, 8 participants. Anybody else? 9 participants are there. So 16, 9, 0, and 5. 8 only. Okay, please put your hands down. All of you, please put your hands down. Okay, even I am also confused right now. Where did you find the answer, please? Adenosine levels increase in the basal forebrain when cats are not asleep. See, what about the first one? Cats could be kept awake by playing with them. Where is it? Found that when they kept cats awake by playing with them, a compound known as adenosine increased in the basal forebrain as the sleepy felines stayed up longer. Yes, we have to conclude C or D as right answers. I am a bit confused now. Can somebody please give an explanation for this? Jaswin, what is your explanation? My brain seems to be dead. Jaswin, can you please explain for others?
For
Sleep means
D,
not sleeping, right?
Once again?
Sleep means not sleep. Sleep means not at all sleeping.
When somebody is awake, yeah. Cats are
Yeah.
awake, yeah.
Not asleep means they are sleeping.
No,
When adenosine levels
not asleep means they
increase,
are awake.
not asleep means awake.
Yeah, not asleep means I am asleep means I am sleeping. I am not asleep means I am awake.
Okay.
There's a confusion.
I think D is right answer.
D will be the right answer. Okay, somebody else can explain this. Parag, can you try?
Yes. So the compound known as adenosine increased. I mean, this is the level.
Mhm.
Then in the basal forebrain, as the sleepy feline stayed up longer and slowly returned. I mean, also this is also a level.
Okay.
Return to normal levels when they were later allowed to sleep. So I prefer that. I mean, no other sentence or
Okay.
similar. A, B.
So you go with which one? C or D? You'll go with C or D?
D, sir.
D. Sleep deprivation in cats. Cats raises.
Yes. The level of adenosine.
That's true. That is true. Sleep deprivation in cats raises the levels of adenosine. That is true. There is no doubt about that. But then what about this? Adenosine levels increase in the basal forebrain when cats are not asleep. Even that is also found by them. Maybe I need some time for finding a solution for this, because suddenly I think my own adenosine levels have gone down or up. Something happened to me. I will explain this one later. If anybody can explain this, you can try. Vinny, you can try. Anybody can try. Otherwise, I will
That
try. Yeah.
it is sleep deprivation means staying up for longer time. It is
Longer.
said in
Yeah.
the sentence that stays up for longer time. In
Mhm.
C option, that cats are not asleep. So just while
Okay.
only
Okay.
for
Fine.
it is
Yes,
not mentioned as longer period.
exactly. Yeah, there is no mention in this case like they are awake for. I mean, this longer is not mentioned in the C. So sleep deprivation in cats raises the levels of sleep deprivation means you are not sleeping. You are deprived of sleep. But in the C, adenosine levels increase in the basal forebrain when cats are not asleep. It's not necessary that, see, suppose a cat is asleep from 7 o'clock to 8 o'clock. And then from 8 to 8:05, the cat is not sleeping. But this short span of awakeness will not be affecting the levels of adenosine. That means an extended time period is required for deprivation. Deprivation is, see, suppose DO was sleeping from 12 p.m. 12 a.m. to 2 p.m. So he slept only for 2 hours. So there is a sleep deprivation is there. But suppose Dio is sleeping from 10 p.m. to 10 a.m. That means such a long hours of span of sleeping. So there is no sleep deprivation in the case of this one. The necessary amount of sleep is provided to Dio in the second case, but in the first one, okay, so according to Aishwarya and some others, D is supposed to be the right one because sleep deprivation is equal to long time. And in which line do you find the long time? Yes, where is found that? No.
No.
Yeah, stayed up longer. This is the area from where the answer comes. This is the main area from where this answer is coming up. So stayed up longer is there. The word longer is actually confusing here. So sleep deprivation, it is happening only when it is longer. But in this one, the longer thing is not mentioned anywhere here. Adenosine levels increase in the basal forebrain when cats are not asleep. A cat that was sleeping for the last 12 hours just woke up, and it has been woke up only for the last 5 minutes. Do you think that during that 5 minutes, adenosine levels will increase? So definitely your answer was right. Yes, that was what I also thought, I think. I don't know. Yeah. So D is supposed to be the right answer here. How many of you thought D? Now, how many of you agree with the D right now? After the explanation, my own explanation, Parag's explanation, and Aishwarya's explanation, how many of you now agree with the D as right one? Yes, there are 19 of you. That's a great thing. So that means you are ready to change your way of thinking. So with this class is over. Now next is writing. we'll be having a 5 minutes break and then we'll be starting the writing. Those who have completed the 1 month writing training needn't attend this class, but those who have not completed 1 month writing, they have to be in the class. So we'll be starting in 5 minutes. That is the end of this class. We'll be having more classes later. I'll be announcing the timing. Anybody having any question, you can ask me right now. I hope this class was really beneficial for everybody. So now please go to the case notes number 27 in the booklet. And
Thank you.
yes. All right. See you. Bye.
Thank you.
All right.